Hi everyone, Dr. Carri Dominic, pelvic floor physical therapist at Recharge Therapy, and today I'm here to talk about prolapse. So prolapse can be very scary sounding, but oftentimes there's not a lot to worry about. Oftentimes it will the symptoms will go away on their own, but I'm going to explain a little bit more about prolapse. So what is prolapse? It is when the organs in the pelvis start to drop lower in the pelvis. So super common after a pregnancy, a vaginal birth. I also see it a lot in menopause. And a few of my patients that have like other medical issues like chronic constipation, IBS, not as much of them. The most common thing is childbirth, unfortunately. So I'm going to show you my pelvic model. So here's the pelvis. This little line is going to represent our organs. So a prolapse can be your bladder, your uterus, or your rectum, and it's coming through the vaginal canal. You can have a rectal prolapse through the rectum, but rare. So normally, when everything's normal, our organs are well within the pelvis. The vaginal canal generally looks kind of dark. Let's see if I can mimic this. Vaginal canal would just kind of look dark and yeah, it's not much we can see in there. But a prolapse is when this starts to come down. So a grade 1 and a grade 2, everything's still within the pelvis, but we can see it in the vaginal canal. So grade 1 is like it's a little bit lower. Grade 2 is like it's at sort of the entrance to the vagina, but it's still within the vaginal canal inside the pelvis. Grade 3 is when, let's see if I can do this, it starts to come out of the pelvis. So when it's a grade 3, it starts to come out, but it can also go back in. So it kind of depends on like the day, how long you're on your feet, things like that. Grade 4, this thing doesn't do it, but grade 4 is when basically everything is outside the pelvis. Again, it can go back in, but it comes back out. So sounds really, really scary. A couple things I would say right off the bat is most people have symptoms and they're the ones asking their doctor. And usually the symptoms are, it feels like heaviness, pressure in the bladder, in the pelvis. It feels like things are heavy or achy. It's not usually painful, but just kind of achy, uncomfortable. And so that's usually a sign of a prolapse. Like I said, super common after having a baby. I have had a few patients more recently who are premenopausal, so sort of like mid 40s to 50, that their doctor noticed a prolapse during their pelvic exam, but they didn't have any symptoms, so they came to me just prophylactically. So a couple things I want to say. Both those patients that didn't have symptoms came to me because their doctor saw that, and their doctor told them, don't lift weights. Don't lift anything heavy. So that's the old advice. One of those patients, she was a competitive weightlifter. So imagine you go to the doctor, you're getting your annual pelvic exam, and the doctor's like, oh, you have a prolapse. You should stop lifting weights. But that's literally what you do for fun and competitively. And I'm here to tell you, you can lift weights. She continued to compete, lift heavy weights. She was fine. Her prolapse did not get worse. So there are things we can do. So let's talk about a couple other things. So grade 1 and 2, when it's still in the pelvis, it's not going to progress to a grade 3 just over time. That generally doesn't happen. So basically a grade 1 and 2, there has been a lot of pressure from above, childbirth, pregnancy, chronic constipation. So things are sort of like pushed down, stretched out in a downward way. Whereas grade 3 and 4, the ligaments that hold up our organs, at least one of those or more of them have been severed, or they're not holding the organs how they should be. So it's going to take some major event to go from a grade 1-2 to a grade 3-4. And you can definitely have another pregnancy and another vaginal birth and not make your prolapse worse. That's a huge fear that I hear. Sometimes that happens, yes, but not always. And I always tell my pregnant clients, like, we can control what we can control, but that's not everything. Childbirth is nature, and so there's some things that are going to be out of our control. But pregnancy and having another birth does not mean your prolapse is going to get worse. Another common question, can my husband or my partner feel the prolapse with penetrative sex? And no. Generally, no. So I like to use this. This is like a squishy ball, because that's kind of what the organs are like. They're probably even squishier than this, but they just get moved out of the way. So if you have a prolapse and you're also trying to have penetrative sex, it kind of just like gets pushed aside. Yeah, so no one's ever told me like, oh, my partner could feel it. So I think that's one less thing to worry about. And then the other thing is exercise. So yeah, you can absolutely exercise. So the only thing I tell people is don't hold your breath. So if we hold our breath, it's pressure down. You know, think about like a heavy lift, right? Or you're just like moving stuff around your house, cleaning your house, and you lift something really heavy. Our natural strategy is to hold our breath, and that's pressure straight down on the pelvic floor. So as long as you're breathing, again, I taught a competitive weightlifter how to continue competitively weightlifting heavy weights. Her breathing strategy was fine, and she was fine. Her prolapse didn't get worse. So you can exercise, you can have sex, you can get pregnant again. None of those things are gonna make it worse. One time in life it may get worse is with menopause. So when we're breastfeeding and when we go through menopause, our hormones are altered, our estrogen's really low, and our vaginal tissues, pelvic model again, the vaginal tissues that would be outside here have estrogen receptors in them. And so when estrogen is low, there's less support from the outside, right? So if this thing is right here and these tissues are really thin, there's less support, versus if these tissues are really thick, it doesn't feel so vulnerable. So that's often why right after childbirth, people feel this prolapse, and it feels really scary. And then sometimes at menopause, when estrogen decreases again, it can also feel worse again. But the good news is there's things we can do about it. So ask your doctor for a vaginal estrogen cream. It has been shown to be safe in multiple studies. It sounds scary. We are freaked out about estrogen, but vaginal estrogen is a cream. It goes on the skin, just in the vagina, and it stays local. It's not absorbed systemically. It just helps thicken these tissues. Okay, it's been shown to be safe for even breast cancer patients. Again, this is a discussion between you and your doctor, but estrogen has been shown to be vaginal estrogen cream, okay? It's not systemic, it's local, it's a cream. It has been shown to be safe. So I recommend to all my patients, ask your doctor about that. Ask your doctor. Then you'll feel more supported. And it won't feel like, if these tissues are thin and it feels like things are right here and they're coming out, if we thicken up these external tissues, then the organs aren't right at they're not so exposed. So ask your doctor. That's my number one advice. See a pelvic floor physical therapist. We can teach you exercises. And so here's another thing. For a long time we thought more Kegels, right? Like strengthen these muscles, support them from the bottom. Now we think, oh, these muscles might be tight. There's not enough space in there. It's pushing, it's pulling. And I find this very frequently in the clinic. These muscles internally are tight. So we loosen those. We give things more space. They're not pulling on it awkwardly. People do better. And then there's also some support garments you can wear. We kind of call it looks like a female jockey strap. But it's from the external, it's supporting here, and then there's like a little belt that holds it up. People have really good results with this. They feel supported, they can go on with their life. If that's not enough, you can ask your doctor to be fitted for a pessary, which is an internal support. It's like a little thing that goes in and it just kind of holds up the organs internally. You have to be fitted for it by a professional. But there's also some sort of temporary ones you can get now. I always forget. There's like tampon company that makes them. I'll link it in the comments. But there's a couple over-the-counter things that you can try. Some people will wear a tampon that kind of supports the organs. If that works for you, do it. I'm not here to tell people they need expensive things. Do what works for you. But I'm here to tell you there are things you can do. You don't have to have surgery. Unless it's a grade 3 or 4, then surgery is maybe warranted if you want it. But if you can live with it, you don't have to have surgery. But if you have a grade 1 or 2, everything's still inside the pelvis. It's not going to get worse, most likely. See a pelvic floor therapist, try these other supports, and yes, there's hope. All right.